If you have a disc bulge and you're hoping it's getting better, you need to hear this public service announcement. After treating hundreds of patients with an L4-5 disc bulge and L5-S1 disc herniation, I can tell you with confidence the biggest mistake people make is not recognizing when their symptoms are quietly getting worse. And by the time they realize it, they are much closer to surgery than they ever wanted to be. In this video, you will have everything you need in one place, the most thorough guide to lumbar disc bulge warning signs that your doctor likely never covered. This video will save you hours from having to piece all this information together from across the internet. Not knowing these 10 warning signs is the worst position you can be in. But when you do know them, you can act quickly, make the right move, and keep things from reaching that dreaded surgery. In my clinic, we monitor every single one of these lumbar disc bulge warning signs for our patients. When something comes up, we address it right away, whether that means adjusting the direction of the treatment plan or getting the right referral to a medical specialist. By the end of this video, you will know exactly what these 10 warning signs are, what to ask your physio, chiropractic, or medical doctor, and how to get ahead of these things before they get worse. Stay to the end because I will also point you to a step-by-step resource that outlines exactly how to treat an L4-5 or an L5-S1 disc bulge or herniation without surgery, so you can get the relief as quickly as possible and avoid surgery altogether. Hi, I'm Dr. Tam. I'm a chiropractor here in San Jose, California, and I've seen many people wait just too long to get the right help or rely on medications just to get through the day. Now, over time, that pain can start to limit how you move, how you work, and how you live. Now, I created this channel for people dealing with neck pain, back pain, disc injuries, or sciatica who have tried everything and are tired of temporary fixes and want to understand what is actually causing their pain. Here you're going to learn safe, non-surgical, science-based ways to reduce your pain, restore your movement, and get back to doing the things that your condition has been holding you back from. Subscribe if you want clear answers, real results, and the confidence to move without constantly worrying about your pain. Now, I post a new video every week. Now let's start with warning sign number 1. Increasing leg pain that travels further down the leg. With an L4-5 or an L5-S1 disc bulge, pain that spreads lower into the leg is often a sign that the nerve is becoming more irritated. What may have started as discomfort in your lower back can move into your glute, then into your thigh, and over time it may continue down into your calf or even in your foot. Ask yourself whether this pain is covering more territory than it did a few weeks ago, whether it feels sharper or more intense, and whether it is happening more frequently than before. When symptoms travel further down the nerve pathway, that typically reflects greater nerve involvement, and that is when worry starts to build, and you may begin to question whether things are moving in the wrong direction. And that fear of ending up in surgery becomes even more real. The important thing to understand is that if this shift is not recognized early, nerve irritation can persist much longer and recovery becomes significantly harder than it needs to be. This is exactly why knowing this warning sign matters, so you can bring it to your physio, chiropractor, or medical doctor right away and get ahead of it before it progresses further. Warning sign number 2 is increasing numbness or tingling in the leg or foot. This can sound similar to warning sign number 1, but it is different. The first sign is about pain traveling further down the leg. This sign is about changes in sensation. That distinction matters. With an L4-5 or L5-S1 disc bulge, you can sometimes develop numbness or tingling in the calf, foot, or toes without having much lower back pain or even shooting pain at all. Now that surprises many people. Have you ever felt a patch of skin that seems dull? Does your toes feel fuzzy or slightly disconnected when you walk. Even without sharp pain, this is still a problem. This pattern is called peripheralization. Symptoms are moving further away from the spine, and that is progressive. What we want to see is something called centralization, where symptoms move back towards the lower back and reduce in leg pain. When sensation changes begin, it can signal that the disc bulge is getting worse, not improving, and that deserves careful attention. Warning sign number 3 is increasing leg weakness. Now, this is different from pain or tingling. Weakness means the muscle is not responding the way that it should. With an L4-5 or an L5-S1 disc bulge, nerve compression can start to affect strength. Have you noticed your foot slapping the ground when you walk? Do you feel the stairs are harder than they used to be? Does one leg fatigue faster or feel less stable? Weakness suggests the nerve signal to the muscle is being disruptive. That is more advanced involvement. When strength begins to decline, it is a clear sign that the disc bulge may be progressing and needs immediate attention. Stay to the end of this video because I will point you to a resource that outlines the exact steps we use to treat disc bulges and herniations without surgery. Knowing the warning signs of a disc bulge progression is one thing. Knowing what to do to get it corrected, healed, and stabilized for the long run is an entirely different thing in itself. Warning sign number 4 is pain that worsens when sitting. With an L4-5 or an L5-S1 disc bulge, prolonged sitting places increased pressure on the lower discs. If your symptoms are intensifying the longer you sit, that is meaningful. Do you feel relatively okay standing or walking, but within minutes of sitting, your leg pain or numbness increases? Do car rides leave you stiff, irritated, or flared up for hours afterwards? When sitting tolerance decreases over time instead of improving, it suggests that the disc is not calming down. Reduced tolerance to a load is a sign that the irritated tissue is becoming more sensitive. If everyday positions like sitting are triggering stronger and faster symptoms, that is not something to ignore. Warning sign number 5 is pain that worsens with coughing, sneezing, or straining. This is one that often catches people off guard. A simple cough or a sneeze should not send a sharp jolt down your leg. But with an L4-5 or an L5-S1 disc bulge, increased internal pressure can momentarily stress the irritated nerve. Have you felt a sudden spike of leg pain when you cough? Does sneezing trigger a quick electric sensation into your glute or calf? Do you brace yourself because you know it's coming? These moments increase pressure inside the spine. If they consistently reproduce or intensify your leg symptoms, that suggests that the disc and nerve are highly sensitized. When everyday actions create disproportionate pain, it is a strong indicator that the disc bulge may be progressing rather than settling down. Warning sign number 6 is symptoms that take longer to calm after a flare-up. With an L4-5 or an L5-S1 disc bulge, small aggravations can happen. You sit too long, you bend awkwardly, you lift something light but in the wrong position. Early on, symptoms may spike and then settle within hours or a day. Have you noticed that flare-ups now last several days instead of a few hours? Do you feel like it is irritated and it stays irritated? Does it take less activity to trigger a bigger reaction? When recovery time between flare-ups increases, that suggests that the discs surrounding the nerve tissue are becoming more sensitive and less resilient. A longer recovery window is often a sign that the condition is progressing and that your spine is not tolerating the stress the way that it should. Warning sign number 7 is a loss of reflexes in the leg or ankle. This is not always something you feel, but it shows up during a proper neurological exam. With an L4-5 or an L5-S1 disc bulge that affects the nerve root, it can begin to alter your normal reflex responses. The knee or ankle reflex may be reduced compared to the other side. The difference is not random. It tells us that the nerve is not conducting signals properly. Has a provider ever tapped your knee or ankle and mentioned it was diminished, but did not fully explain what that meant? When reflexes change, that suggests deeper nerve involvement. At this stage, a referral to a neurologist for further evaluation is often appropriate. Now, a nerve conduction test can help determine how far the nerve irritation or damage has progressed and guide you through the next steps safely and responsibly. Warning sign number 8 is increasing lower back pain with reduced range of motion. Now, sometimes leg symptoms get all the attention, but the lower back itself can start to feel more restricted and painful as the L4-5, L5-S1 disc bulge progresses. Have you noticed that bending feels tighter than it used to? Does it feel like your back locks up more easily? Are you avoiding certain movements because you expect pain? When range of motion decreases over time, instead of gradually improving, that can indicate rising disc pressure and protective muscle guarding. Your body is trying to stabilize an area that feels threatened. If stiffness and back pain are intensifying alongside nerve symptoms, that combination suggests that the disc is under ongoing stress and not resolving the way that it should. Warning sign number 9 is symptoms shifting further away from the spine instead of towards it. We mentioned this earlier when we talked about peripheralization, but it needs to be addressed on its own here because how important it is. With an L4-5 or an L5-S1 disc bulge, we always want to see centralization. Now, what that means is that the symptoms are gradually retreating towards the lower back and reducing the leg. That pattern tells us the nerve irritation is calming down. Have you noticed the opposite happening? Are your symptoms spreading deeper into your calf or your foot over time? Are new areas becoming involved that were never part of the problem before? When pain, numbness, or tingling migrates further away from the spine, that is called peripheralization. And that pattern is progressive. If this shift continues, it is a strong warning sign that the disc bulge is not improving and requires a reassessment. Warning sign number 10 is a loss of bladder or bowel control or numbness in the groin area. Now, this is a medical emergency. With an L4-5 or an L5-S1 disc bulge or herniation, severe compression of the lower nerve roots can lead to a condition where bladder function, bowel control, or even sensation in your thighs, buttocks, anus, and groin area begin to change. Have you noticed difficulty starting or stopping urination? Any loss of control? Numbness in the saddle region, meaning the area that would touch a bike seat? Have you felt reduced sensation in the buttocks or anus area, or noticed numbness when you wipe? Now, these are major red flags. This can indicate significant nerve compression that requires immediate medical attention in the emergency room. This presentation is part of something called cauda equina syndrome. Even though it is rare, you need to be aware of these red flags because some therapists and medical doctors overlook early warning signs. You need to know exactly what to do if your disc bulge ever progresses to this level. Now, in some cases, this leads to urgent surgical decompression to relieve pressure on the nerves. And if these symptoms appear, this is not something to monitor at home. It requires immediate evaluation. You now have a thorough guide of the 10 most serious and severe warning signs that a lumbar disc bulge or herniation is getting worse. If you have any of these warning signs, be sure to discuss them with your treating health practitioner or your family physician. They must not be ignored. The earlier these changes are identified, the better your chances of preventing long-term nerve irritation or progression towards surgery. If you got value from this video, like it, share it with someone who needs to hear this. If you have a question or a comment, drop it below. I read them and they help me guide future videos. And be sure to subscribe to the channel if you want to discover more tips on how to protect your spine, better understand your condition, and learn which treatments help people achieve long-term relief. As promised, here is the video where I outline the steps we use to treat an L4-5 or an L5-S1 disc bulge without surgery that have helped our patients experience significant improvements in pain relief and quality of life. Go watch it now to see how our patients recover quickly from an L4-5 disc bulge without surgery.